Today we continue looking at inequalities in the world, and the focus will be on health. So we've already had a look at the large gap between the rich and the poor people throughout the world. So that's the developed and the developing countries. And we know that there's enough resources in the world for everyone to have enough food and water and education, but we just have an unequal distribution. You should already have these definitions in your glossary of poverty. So absolute poverty means that you've got nothing basically. No matter where you lived in the world, you wouldn't be able to survive. Whereas relative poverty means that there's a lack of resources available and you can't participate in the lifestyle that everyone else around you is participating in. So just to put into perspective what's happening in the world, if you have a look at the diagram, we've got 80% of all the resources going to 20% of the world's population, which would typically be the developed countries, and then 80% of the world's population only has access to 20% of the world's resources. So that includes food, water, education, and also health, which is what we're discussing today. So there's two ways that we measure the wealth of a country. First is GDP, which we've had a look at, which is gross domestic product. So that's how much money per person the country is making. But a better way of looking at it is looking at the Human Development Index, which is the HDI, and it actually looks at lifestyle and living standards, and this is where health comes into it. It actually takes into account life expectancy, education, the literacy rates of people, and includes the GDP as well. Now, it's fairly general knowledge that not everyone in the world has access to equal health care. So that includes doctors, medicines, hospitals, and in fact, it's quite interesting to see that only 1 in 5 people in the world actually have access to good health services, and we're quite lucky because in Australia we are counted in that. So life expectancy, which is one of the components of the Human Development Index, is looking at the number of years that people can expect to live. And this obviously varies depending on where you live. People in countries that have got high standards of living, like in Australia, we tend to live longer because we've got access to food, shelter, healthcare, and hygienic living conditions. But people in poorer countries with lower standards of living, they actually have a reduced life expectancy. So just have a look at a clipping here that I got from a really good Google tool. Actually, it's public data, and you can type in different countries and compare different statistics. So what I've done is have a look at the public data of life expectancy. So if you have a look over onto the right there, you can see the list of the countries. So I've got France and Australia there, so we're both developed countries, and you'll see that our life expectancy is quite high compared to the other countries, and it's fairly even, so ours is very similar. When we go down then to the Middle East and North Africa, you'll see that life expectancy is below ours, and it's probably not quite 10 years. But also have a look, follow that red line back towards the left, and you'll see that in 1960 the life expectancy of the Middle East was actually less than 50 years old, whereas ours has stayed fairly stable. We were at around 70 years, and then that's just jumped up to 80 years. But that's quite a dramatic drop for people in the Middle East. So Philippines has been a steady rise, but they also have a lower life expectancy. South Asia, lower again. And then if you just have a look at Sub-Saharan Africa, you'll see that their life expectancy is around, well, it's under 60, so about 57, so that's compared to our 82. So you can see as we move into the developing countries, their life expectancy is a lot less than the developed countries. So this little diagram is a few years old now, it's from 2008, but what it's doing is comparing life expectancy and GDP. So you'll see we have the developed countries of Japan and Australia at the top, and you'll see that our life expectancy at 82 years, our GDP, so gross domestic product per person, is in the $30,000 mark. And as you get down and further into the developing countries, you'll notice that the GDP decreases by quite a lot, and life expectancy is also decreasing. So that's telling us that people who have that less money per person also have a lesser life expectancy. And in Mozambique, life expectancy is 41 years and their GDP is only $900 per person. So infant mortality is another statistic they look at when they're assessing the health of a country. So you'll need to put this into your glossary of terms. So infant mortality rate, which is IMR, is the number of deaths per 1,000 babies, and it's all babies under the age of 1. So we generally find that the infant mortality rate, so the deaths in babies, is higher in developing or poorer countries. So again, I've used the public data Google tool to put in infant mortality rate, and you can do this for a lot of different statistics. So, so 0 deaths is obviously at the bottom, and if you look at the Congo, their deaths in 1975 of infants was 140 per 1,000, so that's quite a lot. That's over 10% of babies being dying before the age of 1. So just pause for a minute, have a look at how the developing countries and the developed countries compare, and also the blue dotted line is a world statistic there, so you'll see that Australia is very much below the world infant mortality rate average, whereas places like the Congo are much higher than the world rate. So a big problem in the world in regards to health is the epidemic of HIV/AIDS. So if you have a look at the map, this shows you estimated adult and child deaths from AIDS, and it's 2011 statistics from the World Health Organization. So you'll see there that Africa, which is in the red, have the highest death rates from HIV/AIDS, and that moves up. And then you also look into Southeast Asia, has quite high rates, whereas Australia quite low rates of deaths from HIV/AIDS. So it is the world's 4th largest killer and the biggest cause of death in Africa. There's 30 million people worldwide with HIV, and 2/3 of these are in Africa, and most of those would be women and girls. So that's a really sad statistic, and it's often due to poor healthcare systems and a lack of education that is responsible for the spreading of the disease. So the number of AIDS deaths has actually decreased in recent years, but as you can see by those deaths in Africa, it's still a huge problem in the world. So while those statistics for infant mortality rate and life expectancy don't look very good, there's actually been huge improvements in health in developing countries since the 1960s, and that's mostly due to all those organisations, the NGOs, going in and improving the living conditions for people in those countries. So worldwide, they've actually had a decrease in child deaths and malnutrition, and the access to water and food have actually increased. So a big reason why we've had improvements in health is due to these Millennium Development Goals. So the 3 goals that are linked to health are reducing child mortality, improving maternal health, and combating HIV/AIDS. So we'll just have a look at each of those goals in a bit more detail. So Millennium Development Goal number 4 was to reduce child mortality. So in 1990, there was actually 12.6 million children under 5 died, whereas in 2012 that figure had been reduced to 6.6 million children. So while 6.6 million is still a huge amount, that decline by 47% is a huge achievement. The 5th Millennium Development Goal was to improve maternal health. So maternal health is mother's health. So there've actually been a huge reduction in the number of mothers who have died, and so that's gone from 523,000 in 1990 to 289,000 in 2013. So they're actually getting more doctors and skilled people to attend birth, so that's actually helping for mothers to stay alive during childbirth. But if you have a look from the map, you'll still see that there is quite a lot of deaths through that African region, so that's the bright and the dark purple. So there still needs to be a lot of work done there so that we can reduce the number of mothers who are dying. And the 6th goal relating to health was a goal to combat HIV and AIDS, malaria and other diseases. So 2012, 2.3 million people were newly infected with HIV, so that's 33% less than, say, 10 years before that. You've still got Africa accounting for 70% of the people who are getting the HIV infection, and there was an estimated 35 million people living with HIV in 2012. So that's shown up as an increase from previous years. But the reason for that is that people are actually living because they're getting the medication that they need and the hospitalisation to actually keep them alive. So while the deaths have decreased, people living with AIDS has also increased as well. So some things for you to think about before our lesson is, when was the last time you visited a doctor and how long did it take to see the doctor? I know here, if you go to John Hunter, sometimes you're stuck there waiting in emergency for over 4 hours, but you actually do get in to see them, and if it was something life-threatening, you would be seen to more quickly. So I want you to have a think about how long it's taking you to see the doctor, and what might have happened if you didn't actually get to see that doctor. And you might want to discuss with your parents how easy it is in Australia to access medical supplies. So if you are unwell, how easy is it for you to actually get the treatment that you need?